and one female, 34, who is a close contact also of the first patient, was confirmed similarly so, based on the contact with that first patient. I should note, and this is a point worth making, that we have patients in isolation in Mandeville, St. Anne's Bay, Cornwall Regional, Chess Hospital, and the University Hospital of the West Indies. And I make the point, not just to be transparent, but to say that the public health system does have the capacity to provide the isolation services that are required, the personnel to provide the appropriate levels of services in these institutions. Now, I know these numbers are small and they are expected to rise, but it's an indication of a trial run, if you will, in preparation for what may have to be the case later on. And then, of course, in terms of quarantine, the team have been out in the field in the respective areas, interviewing, collecting information, getting information from those patients, and by extension, therefore, developing the contact profile for others to determine how to proceed in terms of moving forward.
Thank you, Minister. Now, so that we understand overall strategy, the first strategy of the government was to delay the virus from getting into Jamaica. And we acted very early, putting in place travel restrictions and managing our ports, specifically as it related to cruise ship docking in Jamaica. And I believe we've been very successful. In fact, we would have been 120th or something like that out of the countries in the world for it to come to our shores. But we always knew that it would come. Our strategy was to delay it as long as possible. So now we are into the phase that we can conduct effectively contact tracing. So we want to use that as far as possible, CMO, to contain. And what we're doing now are taking all the measures within the next 14 days. We're in that 14-day period of containment. And we're going to try as hard as possible to contain it. And the two strategies of prevention and containment, they have to work together for some time. And therefore, we wish to today announce that we will impose a travel restriction on the United Kingdom. The Minister of Foreign Affairs is here if you would want to join us. There might be things you want to explain. I'd ask the Permanent Secretary in the Ministry of Health if you would want to join us as well to explain what that means, the travel restrictions.
Good afternoon, everyone. Good evening. My apologies. So the travel restrictions are in similar light to the travel restrictions that we have put in place for the 8 other countries that are on our restriction list. First, only citizens and persons who have residency or long stay arrangements or marriage exemptions will be landed in country. All other persons will not be landed at this time. Additionally, persons who are landed will now be required to be quarantined. And based on the Ministry of Health's risk assessment,